And welcome back to the COVID-19 report. Today we are talking dental health. Right now, many dental practices have been sidelined by the coronavirus pandemic.
That's right. It's due to the fact that the American Dental Association now advising to reschedule all those elective procedures. Joining us right now is Palm Beach dentist Dr. Mitchell Josephs. He's here to explain the difference between elective and essential. And doctor, this may seem obvious to some people, but maybe you could explain better.
Since March 20th, the governor has ordered that all physicians, surgeons, and dentists are to refrain from elective procedures and only treat emergencies. What I'm concerned about, as are many dentists, is that we feel that the general public thinks that a dental emergency is only something where you have a horrible toothache, and that's just not the case. According to the ADA's bulletin on what constitutes a dental emergency, off the top, there's at least 7 items that have nothing to do with pain, but are significant dental emergencies that need to be treated. And we're offering a complimentary tele-dentistry consultation. So if people go to my website, palmbeachdentist.com, click on contact, they could take a picture with their iPhone of a dental problem like patients have done already. And by doing this, they'll be able to email me a photo going on in their mouth, and I'll be able to help them with the diagnosis and guide them if they should see their dentist or not. So emergencies that have nothing to do with pain, for instance, if you're wearing a temporary crown or a temporary bridge and it cracks, or it comes off completely, or it's irritating the gum, that's a dental emergency. It may not be painful, but if that temporary crown is left off the tooth, what happens is the opposing tooth is going to drift down. When it's time for your doctor to cement the permanent crown, the bite will be too high. So these are some things that you could also handle at home. You could take the temporary crown off, rehearse placing it back on the tooth. Once you get it right, and you know it's right because when you bite down, your teeth come together, you then take the temporary crown, and with a paper clip, open up the end of the paper clip, scrape out all the temporary cement that's in that crown. Make sure there's no temporary cement on the tooth. And then take Fixodent, which is a denture adhesive, open it up and squirt a few drops inside the temporary crown, and then re-cement it back on the tooth. Then get a hold of your dentist. So that's just one example of a non-pain related dental emergency.
Go ahead, Lily.
Well, Dr. Joseph, you've been so detailed about the dental emergencies and the telehealth. We have a little bit of time left, but again, can you just break down the telehealth and where people can go in and get the access that they need?
Dentistry is such a new word that as I was typing it in my weekly Ask the Dentist column that I write for the Palm Beach Post Accident section since 2004, when I typed out the word tele-dentistry, of course it came out as if I'm spelling it wrong, and there is no spelling of tele-dentistry because it's a brand new term. So complimentary to all people that are viewing this for the next couple of months during the virus crisis, we're offering complimentary tele-dentistry consultations. So if you take a picture with an iPhone of what's going on in your mouth, a tooth is cracked, just go to palmbeachdentist.com, click on Contact Us, and you'll see my email address. You click on that, send a picture, and complimentary for the next couple of months, I'll advise you on what to do. It may be something that you could fix at home. For instance, another non-painful dental emergency is getting something stuck deep under the gum line. Now here's a trick you could do at home. You take your dental floss and you tie 2 knots in it so that there's a thickening of the dental floss. Then you simply run the dental floss between the teeth and you let that thick knot scrape out what's stuck under the gum line. Because many people now watching Netflix, they're going to be eating a lot of popcorn. And every Monday morning, there's always an emergency, and I could always tell if somebody went to the movies or was binge watching on Netflix.
Well, definitely it's important to, that's a great tip. Dr. Joseph, thank you so much for your time and for joining us, and stay safe out there. Liz?
Thanks, Luli. I'm Liz Quirantes in the newsroom. Here's what we're working on.